Alright, so then again, the left atrium and ventricle, so they carry oxygenated blood, and the right atrium and right ventricle, they carry the oxygenated blood. But what you have between them is that interventricular septum. So this is dividing the ventricles from each other. And you also have an interatrial septum that's not visible in this image, but that divides the left and right atria. So a septum is basically something that divides something. So it's a barrier, it's a wall. Like even in your nose, you have a septum that divides it into left and right. But in this case, we're talking about the heart, dividing it to left and right. Now, septal defects. Now, the thing about cardiac embryology, I think it goes a little more depth in both books. Keep it limited to what I cover in the lecture because actually embryology is fascinating, but it's also very complicated in the heart. But what you have here, septal defects. So we talk about two septa. We have the interventricular septum between the ventricles, the interatrial septum between the atria. Now, septa, which is plural for septum, is a set. What they do is separate the chambers and prevent the two types of blood, the deoxygenated and the oxygen-rich oxygenated blood from mixing. Now, what happens if the septum isn't intact? So why do we need chambers? Why do we need septa? Why do we need these four chambers? So thing is that, what if you have a defect? What if you have a little hole or some sort of opening in your ventricular septum? And actually, this is a pretty, not super common, but it's not unheard of seeing this kind of congenital heart defect. So that means this is before birth. You have this hole in the heart. But what happens if this goes untreated? Well, the thing is that the oxygenated blood moves across from the left ventricle into the right ventricle. And you might be thinking wait, so is it even Steven or is it only one direction? So what happens is that now you have increased blood and fluid going to the lungs. Why? Because the thing is that when the ventricles contract, they're actually supposed to pump out the same amount of blood. Even though they have different thickness, they're actually supposed to kind of maintain the same rate of traffic going to the lungs and away from the lungs and to the body and away from the body. So what we have here with the increased blood fluid going to the lungs, well, now that we have the left ventricle kind of pushing more of its work onto the right ventricle, this additional fluid is going to start to accumulate in the lungs. And when we get to the respiratory system, we might talk about that more in detail. Now, think about that. Yeah, so that could cause fluid building up in the lungs and pretty much drowning on the inside. Alright, so what we have here is, again, we have our more muscular left ventricle, and we have our still muscular, but less so on the right side. Now what we have here with this septal defect is that they're meeting. They're both contracting, they're both flexing and trying to push each other and their fluid. But who's going to win out? The side that has more force, right? The side that has more muscle. So this is why it's toward from the left side to the right side, because again, the left ventricle is thicker. It's going to win out that tug of, or push of war, let's call it that way. So this is why we have additional fluid building up in the lungs. But how do you cure that? Or how do you treat that? Even though it's pretty common, they can insert a patch in there and close up that patch. Again, why? So this is how you prevent that fluid buildup in the lungs. By closing that patch, now you don't have the additional workload of all that fluid going from the left ventricle to the right ventricle and building up in the lungs. So yeah, it's very important to understand this kind of balance, and this is why it's very important, especially when we have things like heart failure. It results from an inability of the heart to actually maintain that fluid traffic and prevent things from backing up. But we'll get more to that hopefully by the end of this unit. Okay, so atrium. So we have an interventricular septum. We also have an interatrial septum. So then we have less common than ventricular defects. So the thing is that it's less common, but the interesting thing is that the atria, they do help with they do contract, but actually is they don't generate as much pressure as the ventricles. And if you look at the walls of the atria, they don't have as much muscle compared to the ventricular walls. So the interesting thing about these atrial septal defects, sometimes they go undetected. So we have this kind of back flushing of this oxygenated blood going back into the right atrium, but it doesn't actually necessarily lead to building up of fluid in the lungs. And yeah, if there's fluid in the lungs, the body would not get enough oxygen because that fluid is inhibiting the diffusion of oxygen into the blood stream. But actually, that's something I hopefully will get to in the respiratory system.